Welcome back to Let's Talk Health. In this series, we produce videos to help you stay healthy, safe, and active. In the last two episodes, Dr. Christina Choi talked to us about poor posture affecting the upper body. If you've missed that, please click the link above. In this episode, Dr. Choi will talk to us about poor posture affecting our lower body, such as muscles in the abdominal, lumbar, gluteal, and hip flexors regions. And here's Dr. Choi.
Hello again, everyone. This is Dr. Choi. Today we're doing a continuation of last presentation. So in our last video, we talked about upper cross syndrome as a result of desk posture and poor posture in general. Today we will talk about the opposite, lower cross syndrome. Now, lower cross syndrome, as it's very similar to upper cross syndrome, is where muscle imbalances occur in the lower body. First off, let's review the upper cross syndrome first. Here you can look at the picture where you can see where certain muscles are tight, certain muscles are weak, and certain muscles are affected where our body tries to balance itself. Now, because upper cross syndrome occurs, our lower half of the body tries to compensate for that imbalance as well. Now, when we sit for prolonged periods of time, what happens is a lot of the lower body muscles are affected. When we sit for too long, what happens? Our posture becomes slouched. Now, the first thing that we look at usually when our posture does become slouched is we do have lower back pain. Now, how does lower back pain occur? It occurs because our abdomen muscles, start to weaken over time. Because we slouched, our abs relaxes and they do nothing. Hence, our ab muscles become weak. Now, when our ab muscles become weak, now let me turn sideways to show you. When our ab muscles, for example, I'm supposed to sit in a straight posture. When my abs become weak, I will hunch over time because they don't want to exert energy. If I'm already hunched over like this because my abs are weak, what happens in my lower back muscles is it's working extra hard to prevent my whole body from falling forward. So it's tugging. So it becomes very tight over time. Now, when it becomes very tight, there's other parts of the body that's trying to counterbalance that effect. What other muscles are affected? If you sit for prolonged periods of time, for example, sitting on your bum, are your bum muscles moving? No, because you're putting so much pressure on your bum muscles and it's not moving, what happens is it becomes weak. Now, if your bum muscles become weak, there's an opposite muscle that starts to tighten to prevent your bum muscles from causing you to fall backwards. Those are your hip flexors, the muscles that connect from the front of your pelvis to your lower back area. So when you look at this picture here, you will see that you have weak abdominal muscles, and then that's counteracted by your tight lumbar spine muscles, which in turn is counteracted by your tight hip flexors because of your weak bum muscles, which are called the gluteal group. So besides MSK issues, such as neck pain, back pain, strained neck and back muscles, or even disc damage, due to prolonged sitting, there are also non-MSK conditions that can occur from prolonged sitting and poor posture. So today I'm just going to talk about a few. First off, foggy brain. Why would someone have foggy brain? Now, the forward movement of your upper neck and your head position alters the structure that passes through the neck and the brain. When you're in a neutral position, we have a lot of nerves and blood vessels that supplies nutrients, and sensation towards the head, nutrients from the blood to help us function on a daily basis. If our head is tilted forward a lot of these structures may be affected, not just the bone and joints itself, but the vessels as well. If the vessels are staggered and not a lot of nutrients are going to the brain, the supply is not there, so we don't think as clear, we get tired a lot easy, and we may actually get headaches because nutrients are not getting to where it's supposed to get. Second, heart disease. Why? After sitting for a prolonged period of time, the muscles actually use less fat and the blood flows actually more slowly. When your muscles are not using energy, they actually get stored. So the fats from foods itself get stored in your vessels. Now, if those vessels build up in fat, we have a term that's a little bit more technical called atherosclerosis, where your vessels, okay, they're like this, okay, long tubes. If fats start to build up over time, blood flow is actually very limited. And that could actually lead to heart disease because the heart is not working as much and pumping less blood to where your body needs nutrients. And of course, sitting for a prolonged period of time, that means heart disease may also mean high blood pressure and high cholesterol as well. Third, poor blood circulation. When we have poor blood circulation, especially in our feet, we're not moving. If we're not moving, the body thinks, okay, you don't need to move, your blood doesn't need to pump as much, so we get lazy. So we call our vessels getting lazy. So a lot of time the blood will stay where it's at, especially when we follow gravity, the blood stays at our feet. Now, if that happens, some people may actually get quite a bit of problems. This may include swollen ankles, okay, spider veins, or varicose veins. And varicose veins are where you see those veins in your legs pop up. That's because those veins have weakened over time and have not exercised well enough to start pumping blood back up to the heart. So these are just a few examples of what poor posture, prolonged sitting can do. And of course, there's other conditions as well. They may include diabetes or even colon cancer. So let's look at an image now. Now because of COVID-19 and how our lifestyle has changed over time. In general, even before COVID-19, we've been on our phones, our tablets, and computers for many, many hours. So when you're on your phone, ideally keep it up, okay, eye level. If you're texting, hold up your shoulder and text looking at your phone this way. Or even when you're using your iPad, hold it up this way, or if you're sitting on a couch, maybe prop it up on a pillow. And of course, if you're using a laptop, have it on a table using an ergonomic format. So what can you do now? It is never too late to correct poor posture. Although a lot of structures may change, you can help yourself improve and prevent yourself from getting worse with these conditions. So what can you do? First, pay attention to yourself, pay attention to your friends, pay attention to your family. Maybe you could do with yourself posture assessment, checking the levels of your shoulder, checking your back, just checking the alignment on a daily basis. Be mindful of how you sit and make sure to stretch regularly. So fix your posture as early as possible, or if you know someone who has poor posture, have them fix their poor posture as soon as possible.
Do you have problems in those areas? No worries. In the next episode, Dr. Choi will show us some strengthening and stretching exercises targeting those areas. Please let us know in the comments below what other topics you would like to watch on Let's Talk Health. Stay tuned and remember to subscribe to our channel and click the bell to be notified when the next video is uploaded. Thanks for watching.